Well, now to some truly remarkable medical research which has discovered a new use for body fat. It's a good source of stem cells which can be isolated and then used to treat painful conditions that lead to almost 90,000 Australians getting hip and knee replacements every year. Pippa Gardner reports on the Australian trial using stem cells to treat osteoarthritis.
Frankly, if you'd said, I'll chop both your legs off, I'd have taken it over the pain I was in. It was just excruciating.
I'd be in agony all the time, every time I walk everywhere. If I walk long distances, I'd be crying, tears running down my face.
Like 1.5 million Australians, Ian Weeks and Alana Halliday have osteoarthritis.
So I had the left one replaced, my bionic knee as I refer to it, but $27,000 later, I'm still in a lot of pain.
Like a 90-year-old man, just about ready for a wheelchair.
It's a crippling and terribly painful condition. The cartilage, the spongy protective tissue in our joints, becomes thin and loses its ability to stretch and bend. The bones in the joints can then start to rub against each other. Doctors don't know what causes it. Sufferers manage their osteoarthritis with strong painkillers, physiotherapy and light exercise. When pain becomes unmanageable, the only option is joint replacement surgery. But now, a treatment using our own fat. Dr. Ralph Bright believes it holds the key and perhaps a cure.
So Dr. Bright, what is this?
This is the fat. This is what we've taken from the patient. This is a veritable bank of stem cells.
Dr. Bright will harvest those stem cells and inject them back into a patient's body, or they will get to work repairing damaged tissue and cartilage.
Can you cure someone with one injection of stem cells?
What we do see is that with osteoarthritis, one injection will be enough to take away your symptoms. It'll stop the pain, it'll stop the stiffness.
The treatment is called ultrasonic cavitation and was developed in the US. It's a minor procedure done while a patient is awake. A small amount of fat is removed using liposuction. The patient's own stem cells are then separated from the fat using an ultrasound and injected into their body.
They will automatically home to the areas of inflammation, the areas of need, and start doing the good work to repair and regenerate those tissues.
That's brought life back to me. It's fantastic.
Ian took part in Dr. Bright's first trial. He had stem cells extracted from his fat and injected into his right knee. Within 2 months, he says the pain went and never came back.
Knee replacement was the last diagnosis I had before I had the stem cells. I couldn't believe it. I still can't believe it. Because I'm doing things now. I can run, I can hop, I can skip, I can do anything now. I can squat down on the ground, anything.
Alana had her stem cells harvested and injected into her right knee 18 months ago. The former nurse was initially sceptical.
I was very, very surprised to find that within days I was thinking, oh, wait a minute, that pain's actually going, if not gone. I was able to move a whole palm more freely.
They certainly are the therapeutic miracle of this decade.
I'm saving me pennies now in case I need it. Maybe in the future, if I have to have it done, I'll just go to a decent bank manager and say, mate, I've got to have this done.
As it becomes more and more simplified, this will become a treatment for general practitioners. Your local GP will be able to do stem cell treatment for you.
The stem cell has just got to be the way of the future. It's just amazing. I just can't believe the relief I've got.
Pippa Gardner reporting. More information on that treatment is on our website.
The casualty count from the wars in Iraq and Afghanistan continues to climb. By the most recent estimate, more than 30,000 American servicemen and women have been wounded. But now, an amazing development could change how doctors treat even the most serious wounds. As Wyatt Andrews reports in the second part of our series, Growing Miracles.
Good afternoon, Hobbytown, USA, Lee speaking.
You might become a believer in the power of magic dust.
And I powdered it on until it was covered.
When you see how a special powder regrew the tip of Lee Spivak's finger.
I put it through the back of the airplane.
The half-inch he sliced off in the propeller of a hobby shop airplane.
Your finger grew back flesh, vessels, and nail.
4 weeks.
In 4 weeks.
Right.
Is this essentially what regrew Mr. Spivak's finger?
Yes, it is. We took this, turned it into a powdered form. And
this powder is a medical product called extracellular matrix. Made from pig bladders, it's a mix of protein and connective tissue surgeons often use to repair tendons. But it's the matrix's unusual power to regenerate tissue that's helped launch a new field called regenerative medicine.
It tells the body, start that process of tissue regrowth.
At the University of Pittsburgh Center for Regenerative Medicine, Dr. Stephen Badelick believes the matrix somehow mobilizes cells, some of them adult stem cells, whose job it is to maintain and repair injured tissue.
It will change the body from thinking that it's responding to inflammation and injury to thinking that it needs to regrow normal tissue.
If this helped Mr. Spivak's finger regrow, could you grow a whole limb?
In theory.
That theory that it might be possible to grow an entire limb is about to be tested by the United States military. The Army, working in conjunction with the University of Pittsburgh, is about to use that matrix on the amputated fingers of soldiers home from the war.
Can we make skin? Can we make bone?
Dr. Stephen Wolf at the Army Institute of Surgical Research says the military has invested millions of dollars in regeneration, hoping to regrow limbs, lost muscle, even burned skin.
It's hard to ignore that this guy is missing half his skin. This guy is missing his leg. Is there any way we can make that go back? Some of that technology exists.
Several different technologies for harnessing regeneration are now in clinical trials around the world. This machine, being tested in Germany, sprays a burn patient's own cells onto a burn, signaling the skin to regrow.
You could fashion this into a tube like this.
Dr. Badelick is about to implant matrix material shaped like an esophagus into patients with throat cancer.
So we fully expect that this material will cause the body to reform normal esophageal tissue.
Some of the most advanced tests involve the heart. This patch of material is being put on like a Band-Aid to regenerate tissue damaged by a heart attack.
Injecting one.
And here, patient Mary Beth Babbo is getting her own adult stem cells injected into her heart in hopes of growing new arteries. Her surgeon is Dr. Jun Lee.
It's actually, if you will, what we would consider the holy grail of our field for coronary artery disease.
The holy grail, because if stem cells can regrow arteries, there's less need for surgery.
If people don't have to go through that, this would be the way to go if it works.
This is only 2.5 years old.
Lee Spivak jokes he's got a 69-year-old body and a 2-year-old fingertip. But his fingertip has researchers imagining a time when regrown limbs replace prosthetics, when regrown tissues replace surgery, when the body does its healing with cells from within. Wyatt Andrews, CBS News, Pittsburgh.